So, very good evening
Very good
to
evening.
all of you, and welcome Dr. Nirav Joshi ji on AYG Academy platform Insta Live. Now, over to you, Dr. Nirav ji. बोलिए
Yes.
कैसे
Yeah.
हैं आप और
I'm good.
आपका
All
क्या
well. आप
पर्सपेक्टिव
कैसे
है?
हो?
मैं ठीक हूँ
Everything is
सर.
fine.
बोलिए.
Fine. So today's our topic is male infertility. So we'll talk about the two perspectives. One is Ayurveda and the another is the modern aspect. So first of all, we'll start with some Ayurveda things and then we'll discuss about the modern things. Or we can start with the modern things and then later on we could come to the
Yeah,
Ayurveda.
we can start from the basic. Maybe what is exactly infertility and
Yes,
how it relates with the male causes. Then what
right,
is the prevention aspect, and then
right,
what is the therapeutic? And
right,
maybe your experience, maybe case you have dealt
right.
with it.
So the main cause of what is infertility and sterility? Sterility is there's no chances of any kind of conception, or you can say the conceiving the things. The failure to conceive, right? Having the intercourse for more than 1 year without any contraception. So that's called as a infertility, right? And nowadays it is very common infertilities. And when we talk about the ratio of the infertility in the male and female or there is a not specific reason about the infertility. The first male infertility nowadays the statistics says that 40% people having the male infertility, where in female infertility there are 50% cases we see normally, and the 10% of the cases there are unexpected, like there is a no any specific explanation about those cases. So female infertility is more because of the some gynecological or hormonal issues. Male infertility is a little bit less than female, and in some cases there are female and male both are combined, but you can see there no relation. There is a no cause specifically you find in a male even with the female. So there is a 10% are cases of those things. Right now, what are the main causes in a male infertility? There are four factors which are means you can say the possible factors for the male infertilities. The one is a systematic defects, right? The systematic defect, like if you have diabetes, you are old age, you have obesity. So there are particular, you have some disease in your body. So that's called as some systematic defect in your body. Even if you have a alcohol consumption, high alcohol consumption, or you are a smoker, so there are chances of infertility in male. The same way, some immunological factors are also responsible for this systematic defect in male infertility. The second thing is erectile dysfunction. Right, that's a coital dysfunction, you can say. So nowadays, erectile dysfunction is a very common because it may be because of some diseases, or maybe it's some psychological things or depression. So this is a second the most common causes where there is a erectile dysfunction. So the male cannot perform the sex properly, and that can be a cause of the infertility. The third factor is a sperm defect. There are so many eight kind of sperm defects are there, and sometimes this sperm can be affected by the certain kind of drugs, you can say, and certain kind of lifestyle that also cause this kind of infertility. And we know that's an azoospermia, necrospermia, oligospermia, the less sperm, there's a no sperm, there's a date sperm. Okay, there is a less motility in sperm. So there are so many causes are there for the specific, we can say that's a sperm defect. And the fourth cause is a pathological cause, we can say. That is a some disease, like some acute disease, like if you have a mumps. So in that particular period, your sperm motility becomes low, even the sperm counts become low. So these are the four main factors nowadays we see. And in Ayurveda, we everyone knows there are causes. Vata, Pitta, and a Kapha imbalance are behind each and every disease, whether that is or even it is a. So when we talk about the infertility, so this kind of imbalance, like Vata imbalance causes the infertility. There are you have to define the Vata infertility is there, and if you treat that way, then patient can conceive, right? To the sperm quality and the sperm quantity at the same time. The second is a Pitta related. Nowadays, this Pitta related disorder. We'll talk about this. Now, uh, how we can improve the sperm quality? Like if you are obese, then you should reduce your weight. If you are a thin or lean, then you should improve your weight. The same way, you should do regular exercise. You should even some kind of yoga or pranayam. You should avoid the cold water bath. Like you should eat cold water bath, avoid the hot bath. That's also good because in heat, sperm stay alive. So that is one thing. Then keep your genital proper hygiene. That's one of the also factor that you can go for that. Then follow proper food habits because you have to balance all the imbalance. So you have to follow the proper diet according to according to the season and the your specific recruit. Then drink boiled water. One of the things that you can do because sometimes in water related infertility we can use water. Yeah. If you are smoking, you are doing smoke, then quit smoking. Then you should just quit the alcohol. So these two are the major causes now we see. Even for the erectile dysfunction, these two.
You mean to say smoking and alcohol also has heat, so too much heat is not good for the sperm health, right?
Both are the Pitta's thing. So that increase in body, and that because of heat, the sperm cannot motile and cannot live for a longer time. You should do some kind of meditation and should avoid the stress. You should do avoid the stress. Because nowadays the stress is so because in depression, so that will be sometimes become a cause of male kind of infertility. Yes. Now, let's talk about the function of the Shukra. Because in Ayurveda, we call it Shukra. And
Shukra
Dhatu, according to Acharya Charaka, after Ras Dhatu, 6th day, 7th day, Shukra Dhatu formatted, And according to, we talk about Sushruta says, when you eat a food, after a month, the Shukra Dhatu happens. The Shukra Dhatu is there in a male, even that the Shukra Dhatu that's in a female, right? In a both male Shukra Dhatu and there is Shukra Dhatu. Both Shukra Dhatus are there, right? But sometimes we have a myth like male having all Shukra Dhatu, but even the female having the Shukra Dhatu, right? So function of the Shukra Dhatu, there are in Ayurveda it is described that Harsha, Anandit ho, Shukra Dhatu, aapko khush rehna. When you are in depression, your Shukra Dhatu is less. When you are in happy, your Shukra Dhatu is elevated.
Yes. Got it.
Preeti, like you love someone, then your Shukra Dhatu is potent and high. So you love someone and you are in state of happiness all the time. Then Shavan, you are always, when your Shukra Dhatu is, you are always healthy and young, right? Even you are at age of 60, your Shukra Dhatu is preserved. So you Shavan Rishi, you like always young. And if your Shukra Dhatu is potent and good in quality and quantity,
then you become a Dhiryavan. So these are the common eight.
It means confidence.
Yes, you are
Confidence in you.
confident. Yeah.
Very
And it applies to male and it applies to female also, right?
So yeah, so the quality of Shukra can be managed with the help of Ayurveda and yoga practices, and also detaching yourself from the habits like alcohol, smoking. You continue.
Right.
You continue.
So now we
Meanwhile,
talk about Shukra Lakshanas, how we can define it. So there are particular slokas which describes how Shukra should be, right? So like it should be like the visibility of the Shukra should be white colors, so bright,
transparent, white color,
yes.
transparent.
Then it should be snigdha.
Okay, sticky.
Yes. I am diabetic and my first child.
Yeah, there is a question.
So is there any problem for it? May be a problem for a second time. See, all the diabetic patients no, that's not necessity of having infertility, right? That is one of the cause for infertility. So all the patient, right, having diabetes, they are not like they are infertile. Okay. So if you have diabetes but your sperm, you can go for a sperm examination, quantity and quality are okay. So there is no issue for consumption, right?
Yeah. So Dr. Dosha is saying if you are diabetic, if you are maintaining your right diet and lifestyle, like sugar level can be balanced, and like that you can balance your own, your Shukra Dhatu quality, and you will not have any problem if you connect with your doctor and share your details. If you need Dr. Nirav Joshi help, he is going to guide you. Yes, sir.
So we were talking about the sugar quality. Like a fatigue, it should be like a drought. It should be sticky. It should be like mansnigdha. It should be the taste of the sugar should be madhur, right?
Honey like taste.
Right. Then madhu gandhi. It should be smell honey.
Smell like honey.
Right. It should be taste should be like madhur, sweet taste, but it should smell like the honey. Right. So these are the simple physical. You can take the own examination in ancient days where there were no. So by this parameters you can examine your Shukra and like the all parameters are your Shukra is a healthy. Is healthy. You have a good quantity of sperm. Now. Broad factors of infertility, right? So when we analyze the Shukra, so there will be, if you will go for the testing, so there will be 4 kind of parameters you will see. One will be the volume of your Shukra sperm. The second is a viscosity. The third is pH of your Shukra, right? Then the motility of your Shukra, active, sluggish, non-active. These all are the parameters. By you will come to know you have infertility or you have issue-related infertility. Your quantity is low or high. If you have a good sperm quantity, but the sperms, motile sperm are less, right? If you very less quantity, but all the sperm are motile and active. So there may be a vary to person to person, maybe a vary for the infertility. Now we will talk like if you have a less sperm or when you that quantity is a very less, then what you should do? You should take a milk. Right. You should take all the sticky materials, things like you can take a ikshu rasa, you can take a shatavari, you can take a amlaki, right? So you should take this kind of to improve the volume of your Shukra. Right? When your Shukra is alpha, you can improve by this 4-5 herbs and this food.
So, so 5 herbs, what you mentioned about that Ikshuras, that is the
Yeah.
Ganneka Ras, right? Ganneka Ras. And milk,
Yes.
Shatavari. Uh, fourth is
Fourth is Vidari Kand,
Vidarikan.
and
Okay. Amla.
yeah.
Okay. Fantastic. Yeah.
Okay. Now to improve the viscosity, the Pitta in a Shukra, we person can take a Trifla, then Lohasav, Ashwagandha, and Kapikachu. These 4 herbs.
Okay. But these herbs, do you recommend? Means the people who are listening to us, we need to tell them that don't go directly to Ayurveda clinic or a Ayurveda the medical and ask them to give that kapikachu and things. So
Even
better to tell
yeah,
them to advise
it's
as per
even
doctor.
these are the parameters you have to examine. If you have in Shukra, there is a less pitchita, there is a less shakiness, then this kind of herbs will be helpful, right? And the second herbs I have told you 5 things. If you have a liquidity of Shukra, then the 5 will be helpful to you, right? So the same way, by Ayurvedic perspective, you can examine Shukra with the colors. If it is grayish, then there will be a Vata Vruddhi in your Shukra. There is a Vata. The Vata,
Yes, yes, yes.
right? So for if it is some grayish color, there will be, if it is very white, milky white, then that will be a Kapha related disorder. So if you see it this way, by even you can see it clearly. There is no need of any examination. So
here all the listener who are listening us, sir, your voice is still breaking in between. So I need to again repeat what you are saying. I can understand because I learned Ayurveda, so I can literally I can hear some word and I can guess what you want to say. So, sir said that you can observe your semen when ejaculated. You can see the stickiness. You can see the color. You can also observe or even taste the smell, like it should be honey-like, or smell also should be honey-like, and you will find that okay, this is good. But then, if you want to find out is there any abnormality, so as per your dosha predominancy, you will find some peculiar symptoms. If vata related problem are there, then maybe quantity will be reduced, maybe there is a blackish discoloration instead of white. So if it is pitta related, you may have burning sensation. If it is kapha related, you may have the bulky ejaculation, the quantity is more, stickiness is more, and it is not having that the viscosity which is required as a optimum or the good shukra, right? Okay,
right.
sir, go ahead.
So when you have a Pitta in your Shukra, so there are 3 herbs. Pitta, you should take a sari, Satavari, right?
Sari.
If the same for Pitta Drusti, you can take a Chavan, also helpful for the Pitta because the amla is there and some other herbs are there, right? If you have like milky white Kapha Drusti, you can go for the Trifla, Lohasav, right? These 2 you can take. You can any kind of any low.
Chromosome means it's related to anemia, right?
Not related to directly for the right. It reduces the Vata. It reduces the Kapha because the low is of property of Ushnata, Tikshnata. So because of that, it reduces the Kapha.
Yes.
Right.
Yes.
So even the pH, if you have a Vata related problem and the pH is a little bit higher, so in Vidari will helpful to you. The same Shatavari will help, and even the Kokilaks, these 3 are also useful. We are not talking about any kind of metal drugs here. We are just talking about the herbal, which are all the herbs which are helpful. If you don't know any herbs, good, then you can directly use Ashwagandha. and the rasayan will be the for any kind of infertility. You can blindly take Ashwagandha.
Okay.
Yeah.
So, yeah. What next?
Fine.
Do you have any practical
I
experience
have
that
so
you
many.
have given?
Yes. I have so many
Okay. Let's discuss some cases here.
male related infertility, and I have treated with the herbs, and we have got with the zero aspermia. I have treated so many zero sperms. You know, they tested twice, thrice. Even they have changed so many. We did the panch karma for 15 to 20 days. I could, and then we got a very good result within 2 to 3 months. So there are certain cases that we get the result, but if we overall we see the scenario in a male infertility, the spermia is there. There is a zero sperm. The quality we can improve. Ayurveda having the very good herbs and rasayan which can improve the quality of the sperm, even the quantity of the sperm, even the it is helpful in erectile dysfunction. It is helpful for premature ejaculation. So there are so many herbs that definitely helps really tremendous. But overall, when we see the cases in male infertility, the statistics say that 25 to 30% only relieved by the Ayurveda and some sort of medication. The 70%
Yes.
male infertility remain the same.
But I observe in my practice that there are very few male people, come forward to do their test. If there is, if they are trying, couple are trying for number of times and 1 year, 2 year, but every time first woman goes for, doing all the kind of investigation, and main comes after that. Basically, why like this? Or do you also have such a kind of,
No,
scenario in your practice?
for the male is okay, female is okay, right? In Ayurveda, we have there are four factors which are responsible for this. You must be knowing because you are dealing with the girls and you are teaching so many things. So this will be like a Rutu, Kshetra, Ambu, and a Bija. These four factors. So
Yes.
we define this. Okay? But in male infertility, there is a very less chances of a Ritu. Ritu is not related to any kind of. Even we talk about the kshetra. So in maximum patient the kshetra. In some patient we find any anomalies, So, but
Yes.
99% patient we don't have any kind of thing. So
Yes.
nutrition part and the beach, both the sperm quality, the nutrition part. That's we call as nourish. That's these two things are main when we talk about the male infertility. So when if the patient having not and he's not taking any good supplement is necessary for the as a Vajikaran, then that factors. So if we have this and then this is deal with the Ayurveda very nicely. Even for the
Yes.
there is oligospermia, azoospermia, right? The motility of sperm.
I'm surprised. I'm surprised by listening that azoospermia means the in which that the male do not have sperm in the semen at all, and that has been cured. So it's really interesting to find why azoospermia was there, what was the cause, and how you have treated. If you can just share that case, because this is very important point and important case.
Right. See, there were a patient, right? They were trying since last 4 years, and the patient was quite young. It was like you can 28 years old, and he got married. And they were trying to conceive, and lastly, because at the time when if the couple is not conceiving, the first doubt goes to the female, and then secondly, we go for the male because of the ego. And then when the male comes in a picture, when females all the parameters are normal, then male comes in the picture, and then at time of male's sperm examination, right? This kind of things come, and the patient came with the zero sperms. Then also we went for the sonography, right? All the check, all this organ, right? That everything was normal. So we treated with the Uttar Basti because maybe some blockage in the. So we.
So what is Uttar Basti? Because we are now, I know what you are saying.
Yes.
Here, the audience who are listening to us,
Right.
so they might be interested to know what exactly Uttar Basti means.
Uttar Basti is a cleanse for the genital organs. Sometimes your urinary structures are there, your urine not perform well, there is some obstruction, right? So in those cases, this is useful. Even the sometimes from factory, epididymis, sperm is the product is enough, but when it is coming from the it dies because of some.
Means the manufacture is happening
Yes.
in the testis, but while traveling, the ducts are there.
Yes.
If there is obstruction in that pathway, then through Uttar Basti, maybe the decoction can just clean the internal blockages and that just allow that sperm to flow, right?
So maybe in that case, there will be a production was the manufacturing was perfect, but there must be some obstruction in the urethra, which was not visible even in the photograph because it was normal.
Yes.
But I can find that is the only behind the results.
Yes. So what are the causes of these blockages? Means, I remember means when I was studying, and even I also do a lot of research in such a subject where I deal with this Garbha Sanskar and all. So one cause is varicose veins. Varicose veins.
Varicose vein is then one of the cause, but nowadays what we are sitting habits, right? Our sitting habits with what we are sitting on the floor, even in the chair all day, 12 hours, 13 hours continuously. Even we are driving, we are continuously driving for 5-10 years. So in that time, there is a Pitta Vruddhi, the Ushnata of the that part increase. Okay, and in that causes the dead sperms.
Sperm do not like heat.
Yes.
That's why even by birth also this testis has been hanged outside this body, because body temperature also not good for the sperm maturation.
So that's why always it is recommended that you should not take a shower with the hot water on your head, because all the senses are there. And the second thing, on your your genital part, you should not take a hot water. Always wash this part with the cold water.
Yes, this is very important point to be noted. All the listener now also and later on also who will watch this, do not use hot water which should be on your head or your genital part, because that may cause the constriction or maybe the vasodilation may happen, and there will be a lot of heat generated, and that may reduce the quantity or the quality of sperm. Yeah. Yes. Yes, sir.
Yes.
Go ahead.
So there are some, if we talk about some research in male infertility. So first of all I would like to share about the ashwagandha, right? When there is in infertility, there is a stress. You can blindly use the ashwagandha. Blindly, you should go for the ashwagandha. Then even sometimes in some cases, I have got the result with the abrak bhasma. Abrak bhasma is also good for for the sperm quality. Even you can see the improvement in the motility. So there are so many research articles about the abrak bhasma. You can see. Then Shatavari Grit, when it is related to Pitta. Shatavari Grit is also cool, right? So these are the some research we can find online related to male infertility.
Yeah.
Male infertility is an ignored subject, because it is all about the infertility. When we talk about infertility, it is always about female. You just female is
Female. That's what
responsible for
you
the
said.
kids. Male is not that responsible.
So yeah, the conception require both sperm and ovum. All should be in the good quality, and both minds of those couple also need to
Yes,
communicate.
that
Then only the
that's called
conception
the
will happen.
Atma Tattva according to Ayurveda. That's when that everything is there. Four parameters are there, but there is no Atma Tattva. Then
Huh.
you can conceive. So Atma Tattva being soulful conception, that is also important.
Yeah. So love and happy and positive thoughts
Yes.
needs to be there in terms of if you think of having baby, both couples should feel simultaneously at a time those feelings. Then only this can be surface in your physical aspect as well. Yeah.
Correct.
Sir, how?
There's some you can see some gold formulation like in Ayurveda. Savana Bhashma also improve the quantity, count, motility. For a period of time, maximum doctors in infertility use this kind of gold formula.
But sir, there is always some doubts, when it comes to Ayurvedic medicine, and when we talk about these metals, the powder which the Ayurveda doctor gives, so people have doubts that metal is there and metal is not good for internal health. It may cause some disadvantage. So, what is your view and how you convince people to take? And is there any kind of side effects you noticed in your practice because you are doing all this Ayurvedic practice since 15 years?
I have not noticed that kind of side effect because 90% I am doing the herbal. In 10%
Herbal medicine.
10% cases only this kind of metals. And even when I'm using the metals, I'm always preferred with the good quality, which are just don't give the any name or brand any. But in certain companies, they are years and they are just they are making the drug with the literature like Shastrok for are making very good Shastra. So we trust on those. They are also now research came with they are giving the literature what we want whenever we need, what kind of analysis of the all the material what they are using they can give, they can provide.
Yes. Recently, there was a big expo, Ayurveda Expo happened in Goa. And we all know that what Modi ji is, emphasizing on doing research, and all the clinical doctors, specifically Ayurvedic doctor, needs to come forward now and speak on the, case studies or the result which they are, finding out through their own personal practice. Then make the data, convert that data into the kind of research oriented, and then we can 100% sure that okay, these metals are not causing problem. Whatever the, how you take, how much dose you are taking, are you regular with it? Are you continuing with the guidance of doctor, or are you just started and just taking on and not reporting to doctor? So even the patients has habit, when they have been given some kind of medicine, like you said, abrak or things. I'm strictly, telling all the audience, please do not just take this name and go to medical and get this medicine and start. Please take the advice of your doctor and then keep the follow up with your doctor. Should that medicine to be continue, or when it should be stop, because this medication again have effect and side effects. Many people say Ayurveda do not have side effects. It's not like that. If you take anything, even amrut can become, vish. Even nectar can convert it to poison. So, yeah, sir. So you need
Yes.
doctor like Dr. Nirav. Yes.
So if we talk about as my concern since years I practice, I have not got any kind of side effect my patients particularly. Yes, sometimes if they are not following the regimen what we are doing, like pathya, they are taking medicine. That medicine is not going to work. At the same time, some kind of burning sensation, so that kind of thing can happen. But as per a longer period of time, if you are taking metal, that is not advisable definitely. But for the herbal things and the safe herbs, if you are as a supplement, there's a no side effect. Even for the laxative, people are taking since years, 20 years, and the same laxative they are taking, but there is a no harm, right? So the people who are talking Ayurveda, but you should be a senseful when you should take by particular and correct knowledge you should apply.
Okay. So we have already done 40 minutes. So let's ask some question. We request all the audience who are listening to us, please drop your question in the comment box so that we can cover your answer. Otherwise, the last message what you want to give to our audience, Dr. Nirav.
See, my message will be a particular topic in male infertility. Then, first, you should be a depressed. You should say, even the patient are coming to me has a fertility issue. I just say, just relax what you have. Don't think too much about what you don't have. Okay, because when you are in stress, you are not going to perform well. When you are not going to perform well, there will be less chances of conceiving. So first thing, distress, you always say whether you have a kid, don't have now. There are so many options in the modern. But even with the modern science help, IVF, IUI, so many having no any results.
Yes.
I have seen so many cases they have done IVF, IUI, but they right?
Yes.
Because we are not talking about that, what the other science says, but the first thing is don't stress out first. The second, do specifically physical exercise, right? And have a happy sex life. You should have a happy sex life, then you will definitely. Other than
Yes.
problems, there may be with this correction, right? So these things I would like to say.
Yes, very nice. So last message what Dr. Nirav ji is telling you all that just relax, have a happy life, accept the things as it is. Don't just go on cribbing on what is not
When I
there.
have a case having after 17 years tried so many things, even in even they went to Singapore. And after every time when they used to come, I used to say, "That's जब होना होगा तब हो जाएगा, अभी चिंता मत करो." But 17, 18 years बाद वो consume, right?
Yes. So it takes time. Body has its own way of working, supporting your conception, right?
Right.
Like sir said, IVF, even externally, you allow that, bija to meet, that sperm and ovum to meet. It is said that bij also has its own soul and they talk with each other. Sperm and ovum talk with each other. It may be internally in the woman's womb, or it may be external IVF or IUI, whatever way you are trying to, make them come together. So it's all depend on the internal communication of those two cells coming together. They have all kinds of emotion, soul. So that needs to be, filtered out. If any kind of negativity, any kind of the bad habits or bad lifestyle, or some eating pattern, you need to just change that, modify that, and take the help of so many doctors are there, so many yoga teachers are there. This problem can be definitely solved. There are two types of infertility, primary and secondary, but again, you need to evaluate with the doctor's help and find out what is the cause. And in Ayurveda, we say that if you find out the cause, just treat the cause and the result will be there. With this, let us conclude. Thank you, Dr. Nirav Joshi, for your valuable time coming here and sharing your knowledge, wisdom, and experience. It's really pleasure to have you on this platform.
Thank you.
We will keep meeting and continuing.
Sure.
Thank you so much. Have
Good
a
night.
nice evening. Bye. Good night. Take care.